Hi, good afternoon, everyone. Thank you so much for joining today's Psyches for Network Users webinar. So before we get started with today's training content, let's briefly go over some housekeeping details. We will be using the Q&A box feature via WebEx, so all phone lines are muted for today's training. If you click on the three horizontal dots at the bottom right of your WebEx screen, you can type your questions in the Q&A box. It will be submitted to all panelists by default. Please do not use the chat function as it will not be monitored. We will leave time at the end to address some questions on air. We will also have the slides and recording link emailed to all attendees, and these will also be posted to our public website after the webinar. All right, so let's get started with today's training. Here we have our list of topics. We will begin with an introductory PSYCKES application overview, then move to accessing client data in PSYCKES. We will then discuss how network users can utilize different features we have available in PSYCKES via population health and recipient search, quality improvement in my QI report, and eventually drill down to client level details in the clinical summary. And we also have our utilization reports. We will end today's training with information on additional training and technical support. Now let's begin with PSYCKES overview. So what is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. It is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data, as well as data from other state administrative databases. So what we do is we put all of this information in a user-friendly format, and it's designed to support data-driven clinical decision-making on an individual level, as well as quality improvement and population health management on that provider population trend level. For example, you can utilize the data collected in here to make plans for an individual client or have interventions scheduled for your entire network. With the constant flow of data in PSYCKES, we do have this ongoing data updates where the clinical summary is updated on a weekly basis and the quality indicator reports are updated on a monthly basis. So now that we know what PSYCKES is, who am I going to be able to view in the application? We do currently have over 12 million individuals viewable in PSYCKES. It includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or any state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if your recipient falls within this population, we will have the data included in PSYCKES. Some example of information you can find in PSYCKES include data regarding general medical health, behavioral health, lab and pathology, inpatient or ER information, crisis services information, and many other types. Now, looking at this slide, it focuses on what types of data we have available in PSYCKES. So we have the clinical summary, and this will provide up to 5 years of data. As mentioned previously, clinical summary is updated on a weekly basis, and this includes all Medicaid fee-for-service claim and managed care encounter data across many different treatment settings. In PSYCKES, you will find detailed information on medication, medical and behavioral health outpatient and inpatient services, crisis care coordination, and many more. If Medicaid's paid for it, we are able to display that information in the application. We have all of this data available in PSYCKES. So when does a particular data get displayed in PSYCKES after an individual utilizes services billed by Medicaid? Well, this time lag in PSYCKES can vary upon a couple of different things when it comes to Medicaid-related data. So first, it's going to depend on the type of information. So for something like pharmacy claims, we consider that pretty quick and timely. From the time that the person picks up the prescription to the time it shows up in PSYCKES, it can be as little as 2 weeks. However, for things like outpatient and inpatient services, those tend to take a little bit more time from the time that service actually occurred to the time that's available in PSYCKES. This is sort of dependent on how quickly and how accurately the provider themselves bill for this service. But we do have a variety of different administrative databases that we are able to link up to. And the wonderful news is that we do have a very quick turnaround for these. So there is only 0 to 7 day lag with these data sources. So we have data coming in from New York City Correctional Health Services, New York City Department of Homeless Services, DOH MAP, State Psychiatric Center, adult housing and residential information coming in from OMH Cares, suicide attempt information coming in from State's Incident Management System. We also have data coming in from New York City Department of Health and Mental Hygiene, as well as any documents such as safety plans and screenings and assessment entered by providers themselves in Psyche's My Choice. So all of this data that we just discussed is available in different types of report in Psyches. So we have the individual client level reports, and that is going to be the clinical summary. Again, that's the Medicaid and the state database's treatment history, and that provides up to 5 years worth of data. We also have the provider level reports, and there are four different types. We have the MyQI report, and that will display current performance on all of the quality indicators. So within these QI reports, you can review the names of clients who are flagged. Similarly, for recipient search, you can run ad hoc reports to identify cohort of interest. So you can take a look at a list of recipients in different advanced views, which will show you different information that you may be interested in. Next, we have our usage reports. So usage reports are helpful as they are used to monitor PHI access by staff. You can go into this report and see who is viewing the clinical summaries for specific recipients. You can also see who is enabling access and by which type. We then have utilization reports, and this is to support providers that have value-based payment data needs. And lastly, we have our statewide reports, and these are similar to my QI report. So through statewide reports, you can look up a quality indicator and review statewide proportions by network, provider location, region and county, client residence, region and county, by plan and provider. So these data are available at the aggregate level. So in the past couple of slides, I mentioned quality indicators multiple times. So what exactly are these quality indicators, also known as quality flags? So the New York State Office of Mental Health, OMH, has identified a number of health conditions or treatment issues that are quite important. And what Psyches does is that it tracks individuals who are positive for one or more of these health conditions or treatment issues. So this way, the provider, the network, the managed care plan, local county, or even the state government leadership can be made aware and take necessary interventions to help assist those individuals. The other thing that we do regarding quality indicator is we roll up the information as aggregate data in order to provide prevalence rate at the program level, at the agency level, at the network level, etc. So you can look at the prevalence rate and see where there are opportunities for improvement. So here we have some examples of our quality indicators, such as flags for no diabetes monitoring for individuals with diabetes and schizophrenia. Another one is flag for low medication adherence. Then we have high utilization of inpatient or emergency room services. And the last one is a flag for health home eligibility. We also have our performance tracking indicators coming from New York State Department of Health, and these include many of the substance use disorder quality flags. So while the Psyche's quality improvement report is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6+ months billing data maturation period to allow for service invoicing. So the as of date for these measures in the application reflects the most recent performance tracking data run by DOH. And these measures are based on a 12-month period of services. So now that we have introduced Psyche's application, let's discuss how you can access client data in PSYCKES. So, how can lead networks access client data? So, consent and clinical emergency attestation entered into PSYCKES by your network provider, in which you have a data sharing agreement in place for, will be able to pass on that consent and emergency level of access to you, the network lead. So when this data sharing agreement is in place between the lead network and the network provider, we are able to share this client level data for an individual based on what the providers are seeing. Another way to think about this is that as a BHCC, as an IPA, as a hospital network user, when you have data sharing agreements in place with your network providers, you are going to essentially see exactly what the providers see themselves in PSYCKES. So this allows network users the same level of access as their provider partners to client data. I do have a note here, so if you would like to update the list of providers or the status of a data sharing agreement with a provider, please reach out to our PSYCKES help desk, and in later slides, I will go in more detail regarding this process. Now here we have this wonderful chart that summarizes the client data you as a network user will be able to view depending on what type of access the provider has added. So a client is linked to a provider agency, and this provider agency has a data sharing agreement in place with your network. So starting with the first one, the provider agency attests to a clinical emergency in PSYCKES, then you, as a network user, will be able to view all client data, including data with special protection for 72 hours. Now, let's say a client provided verbal consent and the provider entered this in PSYCKES. You, as a network user, will be able to view the client data for 9 months, but it will be limited. If verbal consent is entered, data with special protection such as SUD information, HIV information, family planning, genetic testing information are omitted. At last, we have our gold standard access type, which is the signed PSYCKES consent. So for this, you as a network user will be able to view all client data, including data with special protection, for 3 years after the last billed service. So in the previous slide, I mentioned that a client is linked to a provider agency, and if that agency has a data sharing agreement with your network, you will be able to view the client's data depending on what type of consent is entered. So I briefly wanted to touch base on how a client is linked to a provider agency. So the first one is automatically. If a client had a billed service at the agency within the past 9 months, or if they are currently enrolled in the health home or care management agency according to DOH MAP, they are automatically linked. Another one is if provider attests to one of the following. So a client signed PSYCKES consent or provided verbal consent, or if it was a clinical emergency, or if the client is currently being served by or transferred to the agency, then the client is manually linked. So let's discuss different levels of access a provider agency will enter in PSYCKES. So the client data, um, so the client data you as a network user will see is dependent on these access type as shown in the comparison chart previously. So starting at the top, when a signed consent is in place, it's going to allow access to all available data, including data with special protection for 3 years after the last billed service. There is also verbal consent. So this is going to be if a client has verbally consented to PSYCKES, but this would only allow access to limited data as it does not include data with special protection and is only available for 9 months. So if a client does not physically sign the consent form, there is an option to verbally consent, but we would encourage providers to get signed consent as it will expand the client data view and allow access for a longer period of time. Then we have the clinical emergency attestation. So this is the break the glass situation where this person is imminent risk of harming themselves or someone else, and we need to be able to act quickly. So this will allow access to all available data, including that data with special protection, but only for 72 hours. Lastly, we have attestation of service, and provider users can select this option if the client is currently being served by or transferred to their agency. So this will link clients to the agency for recipient search reports, but will not provide access to the clinical summary. All right. So, what information is going to be available about the clients in which my providers serve within my network? So, you as a network user will be able to see aggregate data. So, you will be able to view current performance on all of the quality indicators, including the number of clients flagged at both the network and the specific provider level. You can do a very similar search in statewide reports and then have the ability to filter by complex needs, ability to review those proportions statewide, region, county, plan, other networks, and other providers. Then you also have the ability to run your recipient search report. So you can run a cohort search of interest within your network, and we have our utilization reports to help support your network data needs. So all of this is in the aggregate form. So for individual client level, if there is a data sharing agreement and consent in place, you as a network user can see a lot of information. So through my QI report, you have the ability to drill into the list of clients who meet the criteria for a selected indicator. You will also be able to drill into client level data through recipient search. So you can view the name of the client who meets specific population search criteria. And then the clinical summary, which includes up to 5 years of data, but again, available as long as data sharing agreement is in place and consent or emergency attestation is enabled by one of your provider agencies. So now that we know how to access client information as a network user, let's talk about how we can use some of these report in PSYCKES. So the recipient search is a tool for population health management and oversight. And here you can build your own cohort searches, so searching by particular demographics. So recipient search is comprised of these sections such as characteristics, which include race and ethnicity, client region and client county. We have a section for special population, which includes complex needs, high mental health need, OPWDD services, ACT and EOT information, health eligible, homelessness, and etc. We also have a section for quality flag, social determinants of health, service setting, as well as a section for medication and diagnoses. So here we have our recipient search landing page. So the purple box at the top is where you will run an individual search. So if you are looking for one individual client, you can enter their Medicaid ID or Social Security number and run a single search. But if you don't have that information, you can also use the name and date of birth combination. So everything in this purple box is going to be your individual search. And everything in the blue box below is where you will run these cohort searches. So for example, who at my network has these particular characteristics or has this high need population or this specific social determinants of health or is enrolled in this managed care plan or has this HARP status. And then we have our quality flags, and you can also run searches based on specific medication or a specific drug or have a specific diagnoses. We also have this service section where you can look for information such as how many people from your network are receiving crisis services or how many people have been hospitalized more than 10 times. So looking all the way at the bottom, we have this limit results to option where if you apply any of these filters, by default, it will show you 50 recipients, but you can expand this list to 1,000 or more, or 10,000 and more, and so on. So one thing to note when completing cohort searches through recipient search is that if you make multiple selections from the same information bucket, it uses the OR logic. But if you make selections from multiple buckets, it uses the AND logic. So for example, let's say you selected a criteria from special population section. So for example, let's say ACT enrolled. And you also selected a criteria from social determinants of health. So when you select search and run this report, the recipient list is going to show you clients who meet the criteria for ACT enrolled and have that particular social determinants of health. But let's say you come down to quality flags and you selected multiple quality flags from this bucket, it will show you recipient list where clients meet one or the other quality flag. So here's a screenshot of our quality flag, and I do want to point out this as of date. So our data for quality flag is updated on a monthly basis. And here we have a list of all of our quality flags, and you can select up to 4 flags per search. So if you select the control key on your keyboard, you are able to make multiple selections. And at the top, we also have this definitions link. So if you would like to go through definitions for any of these quality flags, the definitions link is embedded in Psyche. So you can simply click this link right here. So when you select this definitions link, it's going to show you this pop-up window right here. And it's going to give you the display name, the abbreviation, as well as the definition. And if you'd like a PDF copy where you would like to save it, or if you'd like to print it, you can also download a PDF copy of these definitions as well. All right. So the next one that we have is medication and diagnoses section. So in this section, you can select by prescriber's last name, drug class, behavioral health diagnoses, medical diagnoses. You can also enter individual diagnoses right here. And the client attribution for this specific section is past 1 year, and that is the default. But of course, you can expand the search criteria by clicking this drop-down option right here. So here we have services by specific provider. So I'm a Main Street network, and this is only going to show me service settings that are provided within any of the providers that are currently within my network. So if I wanted to know who in my network have received services for care coordination, or if they received services for outpatient mental clinic services, um, I can find this information through this section right here. So the client attribution default here is past 1 year. And again, you do have the ability to change that. And if you look over here under the service setting, you're going to notice the small gray box next to the name of the service setting category. And if you select this gray box, it will expand and will show you all the subcategories. And here we have services by any provider. So it's very similar to the last one, where you can search by provider. We have region. We also have service utilization. So for example, let's say if I want a list of individuals who utilize ER services for, let's say, 5 or more times, I can select these filters here and run that report. So here is a screenshot of our recipient search screen when you apply all those filters and run the report. So at the very top, we have a list of all of the filters that we applied. So for specific provider, this is going to be your network name. And then we also have the service utilization that we selected. So in this instance, um, we selected individuals who utilize emergency room services for mental health diagnoses 5 or more times. So all of the filters that you apply is going to show up in this banner at the top of the screen. And another thing that I do want to mention is that you are able to export these information in a PDF format as well as an Excel format. And then the maximum number of rows displayed, that is going to be 50 by default, but of course you can change that information in the previous screen as well. So you run this report, and now it's going to show you the name, the Medicaid ID, the date of birth, gender, race and ethnicity, Medicaid quality flags, Medicaid managed care plan, and then current PHI access. So for name, all of this information right now is de-identified, but let's take a look at this current PHI access column. So let's take a look at the first example where it says no access. So when you have this option, or when you have this stated right here, you are not able to drill into the client's clinical summary. However, if you have consent, so in this instant, we have verbal consent in place. And as you can see, the name of the client is going to appear in this blue hyperlink. So when you see that blue hyperlink, that means that you are able to drill into the client's clinical summary. But of course, if verbal consent is in place, that means the data is going to be limited and it's not going to include information for things like SUD, HIV status, and all those data with special protection. And if we come all the way down here, this is where we have PSYCKES consent in place. And as you can see, the client's name does appear in this blue hyperlink. And because we have PSYCKES consent in place, that means we are able to see all available data, and that is going to include data with special protection. So the previous screen that I showed you, it included the standard view. So if you go to the top corner of the screen, you will see this view option. So when you select standard view, which is the default, it's going to show you the name, the Medicaid ID, the date of birth, gender, race and ethnicity, quality flags, as well as current PHI access. But let's say if you'd like to select other views, you do have the ability to do so here. So when you select this view, you do have the ability to change into different advanced views. And depending on what you select, your information is going to be expanded to include all these additional columns. So let's take an example of high need, high risk. So when we select this advanced view, not only is it going to show me all the tables that we previously saw, but it's going to include the tables with information on Health Home Plus eligibility, or AOT status, or AOT expiration date, suicide risk, overdose risk, and PSYCKES registries. So if you'd like more information, you do have the ability to select all these advanced views. All right, so let's take a look at the high need, high risk standard, or the advanced view. So previously, when we looked at this information, we saw all the columns up until current PHI access. However, when we select this high need, high risk population, now that table is going to be expanded to include all these additional columns, such as OMIG unsuccessful discharge, transition age youth information. So if you come all the way down here, you have the scroll bar, and the further you scroll, it's going to display more columns. So as you can see, we have the OPWDD, NY Start eligible, high fidelity wraparound, Health Home Plus eligible. We also have homelessness data. We have the AOT data. And I do want to point out that for all the rows that you're seeing that's highlighted in red, that means that you do not have access to view the client's clinical summary. But the ones that do have the hyperlink, you are able to drill further into it. And of course, we have the scroll bar at the bottom. And if you continue to scroll, you have the additional information such as suicide risk, overdose risk, and then PSYCKES registries. All right, so now let's shift gears to my QI report. So the MyQI report is a tool for managing quality improvement efforts. So when you log into PSYCKES, you will find two separate tabs for quality improvement measures and performance tracking measures. Again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator. And then that is the clients that are served plus other parameters depending on quality indicator specifications. We also will display numbers with QI flags. So this number includes individuals that actually meet the criteria for the flags, and this will be our numerator. And I would like to make a note that each quality indicator measures have their own specifications, and these can differ from flag to flag. So it's really important to refer to our technical specifications document, which can be found on our PSYCKES website. We also will compare prevalence rates for provider agency, region, and state. You can also filter the QI report by complex need population, program type, client residence, or client provider location, region, or county. You also have the ability to drill into a list of recipients who meet the criteria for a flag. And then we also have a race and ethnicity view for my QI report, which we will take a look at in the next few minutes. And you can also export these reports to an Excel or a PDF file. So let's talk about how to understand the MyQI report. So as a network user, in the MyQI report, you are able to view your overall network performance on your quality indicator. That means you are able to see comparison of providers within your network and identify high volume opportunities for improvement. So you have the ability to further drill down to that list of clients and access client level data in clinical summary to support treatment, review, planning, care coordination for those high risk clients when you have consent from your provider and the data sharing agreement is in place. Please do note that clients are attributed to providers in PSYCKES in the MyQI report that have been served by one of your provider agencies in the past 9 months. So providers within the network are identified when you have requested PSYCKES network access development. So again, if you're in MyQI report and you're drilling in and you don't see a network provider in your list that you would expect, please reach out to our PSYCKES help desk. So now let's talk about the period of observation for quality improvement. And it's going to vary between measures and it's going to depend on what that quality indicator definition is. So as mentioned previously, or you can sort of hover over the indicators to view definitions, which will include the period of observation as well. So the example that we have here is going to be the period of observation for high utilization. That is going to be 13-month look back. So even though the time frame for an individual to be linked to an agency in my QI report is past 9 months, because that's the attribution based on Medicaid, the period of observation is going to be a different time frame. So that means that this person that has been served at one of your provider agencies in the past 9 months had X amount of ER visits or inpatient visits in the past 13 months. And that is why they got flagged in the QI reports. So this is what my QI report looks like in the application currently. So we have the QI report broken out into two different sections. And on the left, you will see the quality improvement as of January 1st, 2026. And these are the measures that are considered more real time and they're run on a monthly basis. And you'll see we have that noted here as well on the actual report. And then on the right, we have the performance tracking measures, and these are run with an intentional lag of 6 or more months. And this is to allow for complete data to be shown in the application. These are not run by PSYCKES, but rather run by DOH, and they are taken from measures from NCQA and HEDIS. So these are not PSYCKES dependent necessarily, but we do get that information from DOH that we put into our PSYCKES application. And also do note that within my QI reports, you can apply different filters when you are viewing any of these measures. So when you select this filter option located in My QI reports, you will see this filter pop-up window, and you can apply filters based on site, program type, managed care, MC product line, age group, population, client residence, provider location. So for this particular example, I am going to select this client region, so New York City filter, and then for a client county filter, I'm going to select the Bronx. So when you run this report, the filter that you selected is, of course, going to show at the top of the screen right here. So we selected the New York City filter for client region and then the Bronx for client county. And of course, you do have the ability to export this information in a PDF and Excel format. So the information and all these numbers that we have here is going to reflect information based on the filters that we just applied. So here we have a list of all of our quality improvement indicators. And as you can see, we have the as of date here. And we do have a note stating that we do run these report on a monthly basis. So for this example, I'm going to select this high utilization inpatient slash ER indicator set. So I drilled in from the indicator set. Now it's going to show me a list of all of the indicators within that set. So one thing that I do want to mention is this hover over text. So if you hover over any of these links, it is going to show you the definition of the indicator. So in this instance, we selected the 2+ ER medical. So if you hover over, it's going to show you the definition, which is the percentage of individuals with 2 or more medical ER visits in the past 13 months. So if you hover over any of these indicator, it will show you the definition. So let's drill into this 2+ ER medical indicator. So now you will go from this network QI indicator number to a specific provider information. So previously we selected high utilization indicator set, and then we selected 2+ ER medical indicator. So when we further drill into it, we will be provided with this provider tab. And this is going to give you a list of your network providers, and you can further drill into this specific provider and get their QI report information. So in this instance, we have ABC agency, and of course, over here, we can see the eligible population, number with QI flags, as well as the percentage. So let's drill into ABC agency. So now we are going from Main Street Network to the specific agency within this network. So this is what the recipients tab will look like. And this is a list of unduplicated clients that meet this indicator set that we applied, as well as the filter that we applied in the beginning. So of course, as mentioned previously, you can have this information in a PDF format or an Excel format. And then coming down to our current PHI access column, so it says no access and you're not able to drill into the information, but we do have the PSYCKES consent in place for this particular client, so you can further drill into the client's clinical summary. So that is going to be our recipients tab. And as you can notice, we also have all these different recipients tabs available. So for example, let's say that you are a hospital network and your hospital has multiple sites. So you would like to see the information based on that specific location. You can go to the site tab and then go to the site recipients. And it's going to only show you recipients for that specific site. The same thing applies to the managed care organization. So you can select managed care organization, and then it's going to show you the MCO recipients. If you'd like to drill into a specific attending and take a look at that recipient information, we have that option available as well. And towards the end, we have this new QI flag and dropped flag, so it identifies clients who are new to this list or dropped from this agency's list since the last QI refresh. So the view that you saw in the previous slide was our standard view. So when you select the standard view, it will display quality indicator prevalence rate for the organization compared to region and statewide prevalence rate. If you select the race and ethnicity view as shown in this slide, it will display quality indicator prevalence rates for clients in different race and ethnicity groups. So Medicaid data is the source for this information. So when the race and ethnicity view is applied, it is applied to both the numerator and the denominator, and the percentage is calculated. So here you can see clients who identified more than one race in their Medicaid registration will be represented by the multiracial group, and the clients who identified as Hispanic or Latinx are, as their ethnicity, are represented in the Hispanic or Latinx group only. And then for clients where race was unknown on their Medicaid billing, they are still included in this total category, but they would not be represented in one of these unique breakdowns. So here when you look at a specific indicator, you can see that breakdown listed here, and it's good to know the percentage that is calculated. You also have the number of individuals who meet the quality flag. So here you can see the exact breakdown by hovering over the graph. So here I can see that this percentage, 40.2%, was made up of 43 out of 107. So you can, of course, export this information in a PDF and Excel format. So I briefly wanted to touch base on the QI trends past year. So when you go to my QI report, the information that you see there is going to be the most recent. So in the previous slides, you saw the as of date listed as January 1st, 2026. But let's say you would like to look at the past QI report numbers. So for this information, you can select this QI trends past year option. And here you have your network name. You can select a specific provider within your network. You can select specific indicator set. And once you apply these filters, it will show you this table at the bottom. And you can see we have the reports for the previous months as well. And of course, if you go to this button right here, you can export this information. All right, so let's talk about our clinical summary. So what is a PSYCKES clinical summary? So this summary it summarizes up to 5 years of treatment history for a client, and the clinical summary sort of creates an integrated view from all databases available through PSYCKES. So we have all these different information coming in from different data sources that is shown in this one clinical summary. So this information is summarizes treatment episodes to support rapid review, and then episode of cares are linked to detailed dates of services if needed. And we have our clinical summary sort of organized by sections like an EMR. So these are some of the clinical summary sections that we have available. So we have general, current care coordination, notifications, alerts, quality flags, plans and documents, behavioral health slash medical diagnoses, crisis services, medications, hospital ER information, laboratory and pathology, radiology, transportation. So we do have quite a lot of information available in the clinical summary. So when am I able to view the clinical summary? And this is just to reiterate that you are able to view the client level clinical summary for clients who are served by a provider in your network in which you have a data sharing agreement and the client has the PSYCKES signed consent or the verbal consent, or the provider has attested to a clinical emergency. So in the previous slides, we drilled into the individual client level information through my QI reports. So to look up a client's clinical summary, you can also do that through recipient search as well. So you can enter the recipient information such as the Medicaid ID and the Social Security number. But if you do not have that information, you can also use the first name and last name and date of birth combination. So let's say that you you entered the client's Medicaid ID and ran the report, but when you see this table and it says no access, it could be due to two reasons. So the provider does not have the data sharing agreement in place with the network, and the provider did not attest to consent or ER access. That's the reason why it shows no access here. But let's say that the provider has data sharing agreement in place with network and the provider has attested to consent or ER access. Under the current PHI access column, it will say PSYCKES consent. And as you can see, the name shows up in hyperlink, so you are able to drill into the client's clinical summary. So this is what the clinical summary looks like. So once you select the hyperlink, the first thing that you will see is this brief overview. So this is a one-pager document that has many of the information summarized here. So I also want to point out this data source information that we have at the top. When you select this, it's going to show you this PDF document where it's going to tell you all of the information that we have available in PSYCKES and where that specific data comes from. So if you're taking a look at diagnoses, medication, quality flags, you can see that here will tell you that it is coming from Medicaid billing database. Another thing that I would like to point out in this brief overview is that you do have the option to show or hide data with special protection. So if you select show, it's going to show you all available data. And of course, if you select hide, it's not going to include data with special protection. So that is our brief overview of the clinical summary. And here we have the full summary, and it is going to have an extensive list of information ranging from general information to current care coordination information to notifications and alerts. And of course, you are able to export these files. And we do have an option right here. So if you look at this 3 horizontal lines that says section, you can select this and go to that specific section instead of scrolling back and forth. So for example, when you select this option, it's going to give you hyperlinks to all of the sections available in this client's clinical summary. So let's say I want to take a look at the crisis services specifically. So I can just directly select this option instead of scrolling into all of these information. So that is one of the features we have available in the clinical summary. So that was an example of the clinical summary that we have in PSYCKES application. So now let's shift gears to our utilization reports. So we have 3 aggregate reports. So the first is the Medicaid Managed Care Plan and product line. The next is the provider network, and this is going to show all the other providers that have also served your network providers clients. So they're not restricted to just your network. Then we have the service settings and volumes, and this report is going to give you count of total individuals and total service claims and encounters received by service type. So the functionality that we have in PSYCKES right now for utilization report as a network user is that you first would select a provider in your network in order to view these reports. We're hoping as a future enhancement that we'd be able to aggregate reports for all clients served by any provider in your specific network. And hopefully in the future, we can also include cost data reports. All right. So now I went to utilization report at the top and it prompted me to select one of the provider agencies under my network. So now we're looking at Main Street Agency. So at first I'm looking at this Medicaid managed care product line and I can see the breakdown of my clients, where they are, and then different product lines and different managed care plans. And I would like to draw your attention to this footer at the bottom of the screen. And it does have important updates regarding some of our data refresh. So for example, the current clients are identified as individuals who received Medicaid bill services from Main Street Agency in the past year. And it's going to give you that time frame. And then it will also tell you that the managed care plan and product line were refreshed as of. So it's going to include the most recent information and it will also tell you when that information was updated. So we do have this footer available on all of these different tabs. So let's go to the second tab that's available. So here we have our provider network. So I can see here, here are the total clients that I have served at Main Street Agency. And here are the breakdown of all of the different services that they've had elsewhere as well. Um, so that is going to be our provider network, and it's not going to be just limited to providers within your network. And then at last, we have the service settings and volume. And here you are able to see the volume type of Medicaid services provided by your agency. So it's right here, but you can also compare that to the information to other providers. So we have columns for Main Street Agency as an example. And then we also have these information for any other providers, and then we do have this total information so you can compare these data. So that is our utilization report. So now that we have introduced how you can utilize Psyches for your network, we would also like your feedback on what are some of the things that you would like to see in Psyches. And this for this portion of the training, I will pass it on to my colleague.
Hi, Ashma. Hi, everyone. Thank you so much for that wonderful overview of what Psyches can do so far for network users. And as Ashma said, we'd love to get your feedback since a lot of you are super users, and we want to make sure we're incorporating your needs into our application when possible. So we'll be asking a short series, just three polling questions to help gather your feedback. And I'm actually going to launch the first polling question now so that you can see the Slido app, which should be in the bottom right-hand corner of your WebEx screen. And we have a little screenshot here of what the Slido app looks like. And I will go on to our first question since I've already launched it, if you don't mind advancing the slide, Ashma. Thank you. So our first question is, what would you like to see in recipient search? Any enhancements that you'd like to be added to help the work that you do? We have just some examples here. If you'd like new filter options, like new population filters that we don't already have, new demographic or social needs options, or any new service settings. For example, here we have critical time intervention and enhanced step down. But are there any other service settings that'd be useful to do group cohort searches on and recipient search? Um, if you could be as specific as possible, that would just be so helpful for us to kind of narrow down exactly what your needs are with recipient search and how we can, look to add new enhancements based on that. So I'm going to leave this first polling question open for a bit. Again, there's a Slido app on the bottom right-hand corner of your WebEx screen. If you're not seeing the Slido app, please feel free to add your feedback in Q&A or even in chat. We'll be saving all three of these, the polling, the Q&A, and chat, for future reference, just so we can look back on the answers that you've provided us. So I'm going to leave this open for a little bit. It looks like we're getting some answers here for some suggestions that people have. This is great. This is very helpful so far. So just, thinking through any enhancements you'd like to see added to recipient search, any filters, service settings, different look back periods, things like that. Seeing recipient search satisfies some folks' needs already, which is really great to hear. I'm seeing some other examples of service settings that people would prefer to be added. Referrals, preventative care gaps. This is really great feedback. Social need options. Thank you. Thanks everyone for your feedback for this question. Just for the sake of time, and please feel free to keep answering this. Even if we go to the next poll, you can, submit an answer for this question and our next polling question. We welcome any and all feedback that you can think of at any time. So let me actually deactivate this current poll. Thank you so much for your answers for question 1, and I'm going to launch question 2 now. And question 2, Ashma has it right up on the screen. Are there any additional data sources you'd like to see added to Psyche? So we know cost-related data would be a big help for our network users, especially. OTDA information would be helpful on certain HEAP and other benefit needs that people have. So getting data from OTDA, any other data sources that you'd like to see added to Psyches that would be helpful for the work that you do that we might not already have or we might not be thinking about just yet. Well, I'm seeing some OTDA votes, which is really helpful to know. And we're definitely aware of the cost-related data requests. So that's something we're currently working on the back end, just to think through how we can add that to Psyches to best suit everyone's needs. So while we wait for some more answers to come in, I did see a question about if we would get the slides and recording link sent out to everybody, and we will be sending the slides and recording link out to everyone within the next day or so. And also we'll be posting it on our public website as well. So you will be seeing an email from us very soon. Homeless members, I'm seeing homeless data, cost-related data. This is really helpful. All right, answers are slowing down, so I will go ahead and give it another 2 seconds, and then Ashma, we can move on to the next question. All right, I'm going to deactivate that current question, go back, and then add our final question in here, which is, would you like to see any functionality updates within the application? And let me launch that. And for example, here, some of our filters in recipient search, like our homeless filter, our complex needs filter, you can multi-select up to four different options within those specific filter dropdowns. So just a thought here, would it be helpful to have more multi-select capabilities within more of our filters? Do you need any additional look back periods that we don't already include? Right now we default to the past year, but we also have the past 2 years, the past 3 years, and I think even further back to other calendar years. But is there anything else functionality wise within the entire application, not just recipient search, that would be helpful for the work that you do? I'm seeing multi-select would be helpful for some people. That's great to know. And I know we're putting a lot of you on the spot right now. So we also have a slide coming up about how you can, think some of these questions through, think through anything that would be helpful to use in PSYCKES that we don't already have. And we have a way to let us know even after this webinar ends. So I'll make sure to give everyone some next steps if they think of any new features after the webinar is over, that would be helpful. All right. I think this is slowing down a little bit. Thank you so much, everyone, for your really, really great feedback. I'm going to just stop the poll now, since we have also a slide here on how to submit specific features you'd like to see in PSYCKES after the webinar ends. So you can email us at PSYCKESHelp, and the more detail that you provide us, the better. So if you could provide a description of the feature you'd like to be added and the purpose that that new feature would serve, how it would help the work you do, and also how could this help a larger group of users. So if you could provide just as much detail as possible, that always helps us to best figure out, what you're looking to add and how we can go about adding that to our backlog. So if you want to go to the next slide, Ashma, I think we're on to the training and technical support. So I'll pass it back to you. And thank you so much, everyone, for your answers. I'll be saving these and we'll be looking at them in finer detail also moving forward. So thank you so much.
Great. Thank you so much, Michelle, and thank you all for taking the time to provide us your feedback. So now we will be shifting gears to our training and technical support section. So previously when we mentioned regarding network provider updates. So if you need to make any changes to your network, please do reach out to our PSYCKES help desk at psycheshelp@omh.ny.gov, and you will be provided your network's latest spreadsheet that we have on file. And we have the specific format where for any new data sharing agreements in place with listed providers, you will be highlighting that in yellow. For adding new providers to your network, that will be highlighted in green. And of course, for if you're removing any providers from a network, that will be highlighted in red. And please do make sure to include your network provider's tax ID and Medicaid provider ID. And once all of that is updated, please send back the Excel file to our PSYCKES help desk, and the updates will be reflected in the application within one monthly refresh. And if you have any additional questions regarding Psyche's application, please do not hesitate to reach out to our help desk. We are open from Monday to Friday from 9 a.m. to 5 p.m. And if you're having difficulties with your RSA token or logging in, we do have an information for OMH help desk where you can call in and get that sorted out as well. And we also listed our website here where you can find additional training guides, previous webinars, technical specifications document. So if you have any questions, please feel free to refer to the PSYCKES website as well as feel free to reach out to our help desk. All right, so I would like to open it for any questions and answers. I know that we are about to reach 3 p.m., but I wanted to see if there were any questions that we can answer on air.
Hi, Ashma. There are no new questions that came in. We did get just one chat, and someone mentioned that it would be helpful to have visible available services for individuals through Psyches. So I think we can take that feedback back to our team. And the only other question it looks like is if we'll be sending the presentation slides and recording.
Thank you, Melanie. And yes, we will be providing the slides as well as the recording link to all the attendees in the next few days, and will also be posted on our public website.
Great, thank you so much. That concludes all of the questions.
All right, so thank you all so much for joining today's Psyches for Network Users webinar. We really appreciate you joining this webinar. So thank you all and hope you all have a wonderful rest of your day.